Welcome to Living Chronic, the podcast that explores the realities of living with chronic illness and disability while redefining how we thrive in our personal and professional lives. I'm your host, Brandy Schantz, a disabled veteran and chronic illness warrior, here to discuss the challenges, triumphs, and untapped potential of life with a chronic condition. Before we dive in, please take a minute to hit the subscribe button on whatever platform you're listening. Now, let's change the way we think about disability together. Hi, this is Brandy Schantz, and you're listening to Living Chronic. Today I'm here with Dr. Frederick Schiffer. He is a psychiatrist and author of the books Dual Brain and of Two Minds. So, welcome. There's actually much longer titles there, but I'm going to make sure to put those in the notes so that I don't mess them up. But welcome to the show. I'm so
Thank
happy
you.
that you're here.
Thank you very
So
much.
I'm really excited you're here because since, I guess to say everything happened to me, I have done a lot of reading about the mind body connection. So I've really enjoyed learning more about what you do, which is study dual brain. So if you could just tell us a little bit more about that.
Right. Now, let me so I have a new book out,
Hmm.
and I'll just plug it here.
The,
It's probably coming up backwards, but it's called
yep.
Goodbye Anxiety, Depression, Addiction, and PTSD: The Life-Changing Science of Dual Brain Psychology, and it's on Amazon. So, um, uh, so and the
Available next day delivery too.
yeah. Okay. And my other book is as you pointed out, it's called Of Two Minds. That's an earlier book, and so there we go. Okay, I just wanted to straighten that out. Uh, so uh, where would you like me to start?
Well, some of the things that were so fascinating to me was talking about, that dual brain and
Hmm.
treating the immature, troubled half of the brain. I know you and I talked about doing a couple little tests. But, as somebody who I myself suffer from PTSD, reading about this particular type of treatment is fascinating. I
Hmm.
know there's a lot of different ideas out there of ways you could treat PTSD. Cognitive behavioral therapy, I think, seems to be the one that I hear about the most. And of course, I've
Hmm.
also heard a lot about microdosing, LSD, things like that. But this, really seemed very tangible to me, probably because I keep reading more about the mind body connection over the years. So it just felt very tangible and like something you could really reach out and understand. Whereas I think many of us who are not in the medical field hear about some of these things and think, does that really work? What does that mean?
Hmm.
But this did feel very tangible to me.
So why don't I explain first what my hypothesis is,
Hmm.
and maybe how I arrived at it, and what the treatment component of it is. Um, so uh, uh, I'm a psychiatrist. I was trained at Harvard at McLean Hospital, and I've stayed there for decades, and I'm still there. Um, uh, and So I've done about 30 plus years of research with multiple publications and and a few books on this. Um, and the idea is my theory is called dual brain psychology, and it's that I've learned over the years that each brain hemisphere can support a separate mind. Now they both have the same social security number and the same address,
Hmm.
uh, and they go by the same name. But if you stimulate, and it's easy to stimulate one brain hemisphere or the other, you get a different personality. And um, uh, that so the hypothesis based on years of research and research that has supported it with a lot of imaging studies and clinical trials and serious research that's unusual for a psychological theory. And uh, So the idea is that trauma is the cause of all of the psychiatric problems that I've encountered. Now, it may not be
Hmm.
true of the whole world, but it's true of my world, and that usually people don't realize how the trauma, especially early trauma, affects them, and it gets stuck in one brain hemisphere. And so the result is that on one side, there's an immature, traumatized person. And on the other side, you're the same person, but the personality is very different. And I'll
Hmm.
look different out one side or the other. And and it's very easy to stimulate one hemisphere or the other with a visual technique. And I also use photobiomodulation, which we could talk about later. But the visual technique is very simple, and I'll use my book to demonstrate it. You cover one eye and the middle of the other eye. So I'm looking out the lateral half of my right eye. And so that's my right lateral visual field. And when I first did it, I just used my hands, went like this, and I asked my first patient to try that, and he was a Vietnam veteran who had several tours of duty and had PTSD, was doing quite well. But when I asked him to do that, he got very upset, and he said, "That plant behind you looks like the jungle." And
Oh, yeah.
I said, "Oh, well, look out the other side." And he smiled. He said, "No, it's a nice looking plant." And and so in my practice, when people look out one lateral visual field or the other, uh, um, I can look different. I can look supportive on one side and critical on the other side, like maybe their parent was or someone. And and so the focus of dual brain psychology is to treat the troubled side,
Hmm.
and that usually when the patient comes in, the two sides are fighting, or the troubled side dominates and doesn't give they don't even know they have a healthy side, and
Hmm.
and uh, and so the therapy is uh, to try to talk with the troubled side, as in a typical therapy. You know, what are you feeling, and what's that remind you of, and where we go is to the trauma,
Hmm.
and then I try and list the healthy side to be sort of a co-therapist, and also is very instructive to the patient to be able to, with a simple technique, feel better and feel,
Hmm.
no, I can handle it,
Yeah.
and it reduces their anxiety and their depression, and so just looking at one side in itself isn't a cure, but it's an aid, and oftentimes if someone's upset about something, they can grab an envelope or their hands and look out that one side and actually make a big change in their outlook and their feelings.
Hmm.
That's very helpful uh, to, to, to my patients. And to have someone in your head who can feel good is surprising and unexpected, and can show the troubled side that there's hope. And
Yeah, I thought it was very interesting to read about, particularly, again, associated with that anxiety, because I've been, I've everybody who listens to my show is very aware of the trauma I experienced in my medical health.
Mhm.
I definitely suffered a lot of medical trauma. I also suffered from PTSD from my time during
Right.
serving in the Army. And I have tried various things. And I've often said that sometimes I feel like the anxiety is not there. I'm fine. And then other days, very small things trigger it.
Hmm.
and I cannot get past it. So learning a bit about dual brain made me think, well, maybe I know how to use that other side of my brain, and it's just I don't know how to get past the trigger over there.
Yeah.
So when you have a patient who you're going through this with, how do you kind of take that next step to figuring out how to overcome that traumatized side of the brain?
Um, uh, okay, I see the the two sides. It's sort of like there was a Steve Martin movie, and I think it was in the 1980s, called The Two of Us. And Lily Tomlin uh, was meditating with her guru, and there was a terrible accident. The humming bowl slipped out of the guru's hands and tumbled down a flight of stairs in Manhattan. And as a result of this accident, Lily Tomlin's mind got embedded in Steve Martin's brain. And so Steve Martin is the embodiment, and you see him going like this, where Lily Tomlin wants to go downtown and he wants to go uptown in Manhattan, and she's screaming at him, and he's telling her to shut up, and this is really what happens in real people. In other
Hmm.
words, the two sides can fight for dominance. Sometimes one, as I said, one side, and usually if someone's coming for help, they're symptomatic. So usually it's the troubled side that's dominating.
Hmm.
And so one of the interesting things is it's just like real people, that if someone said to Lily Tomlin, don't take that from him, go on downtown, it would embolden her. If Steve Martin said, now calm down now, we need to work together, and stop yelling at me, uh, that you can actually affect the hemisphere by talking to it.
Hmm.
And I talk to each person, and and uh, and I actually have sunglasses that were and that these stimulate one hemisphere or the other. If you put them on, they look like normal sunglasses,
Hmm.
but they actually stimulate one side or the other. And so I'll ask the patient to wear them to bring out the troubled side, and talk to it, and say, well, that must have really been difficult, uh, and then we'll flip it to the other side. Now, and I'll talk to the healthier side and say, well, that side's really frightened, and you really need to understand it, and not be angry about it, and that it's not, it's misguided, and needs your help. Um, and um, so um, so how to bring out the healthy side is to be aware that there is a healthy side, and if it works for you, use the lateral vision. Uh, so that's um, excuse me. That actually is very powerful, and these
Hmm.
glasses are powerful. Uh, and uh, and I also have an LED that I put on the forehead. It's called photobiomodulation, and I'm going to set this here so it stops rocking. Okay, sorry. Um, so um, uh, uh, with the photobiomodulation, we're doing a study for fentanyl addiction. It's a large NIH study for the FDA, and
Hmm.
and we think we're getting great results because many of the fentanyl addicts are doing well, both with their dose, they're feeling well, and doing well. Half of the patients get a sham treatment and half get an active treatment.
Hmm.
And it's just a 4-minute light treatment. There aren't any side effects so far, and I've been
Mm-hmm.
doing it actually for 15 years, and other people are doing it. It's a burgeoning field now. It's called photobiomodulation, but I'm the only person who puts the light over the positive hemisphere.
Okay.
Once you use the eye test, I determine which is the positive side, and the light is 2 or 3 times more powerful than the glasses, but or the eye maneuver, but the eye maneuver is easier to do. You just
Right.
put your hands up or put sunglasses on, and so in my practice, usually by the end of the session, I give the person a light treatment and have a study going on right now for depression and getting great
Right.
results.
Yeah, I thought the infrared was very interesting because I'm familiar with it.
Hmm.
I know infrared sauna. I love an infrared sauna.
Right.
I've used infrared and other, I know there's a lot of other ladies out there. We're trying to battle wrinkles. I've got my little infrared light I put on my face to, make me look a little less old. Um, so this idea that it could also help with my anxiety, with my PTSD, with my depression is pretty fascinating. And I wonder how much, using it on a daily basis, would be able to help just in overall health.
Yeah, I actually use it uh, almost every day. And I don't have
Hmm.
time. I don't, but
Yeah.
I would say that I use it about 5 times a week, and I use it for cognitive enhancement. So I'm not, except when I'm choking now. Um, I'm not, and I'm not really anxious now, but um, so I'm not really very symptomatic. But I feel that it gives me a little cognitive edge,
Right.
and now, but you have to use it on one side. So if you're
Right.
using the sauna, you're
Right. It's just all
irradiating both
over.
sides, and that might give some benefit. But you're also stimulating the troubled side,
Right.
and also your trauma was later. In other words, the major trauma occurred as an adult, and
Yes,
and
most of it.
and
Yeah.
so I don't know if it's as lateralized. Most of the people I see have dysfunctional families and maybe an alcoholic father or a
Hmm.
demeaning mother and or a bullying brother. These are the kinds of traumas that I typically see, and
Hmm.
their childhood traumas, and they seem to get lodged on one side. Did you have an effect when you tried it looking laterally, or did that
I
come up?
did. I kept trying it a few times
Yeah.
after we first discussed it, and I did. I tried thinking of a few different things. I think I felt a lot when I thought about my time in Afghanistan. Actually, of course, that's been, I mean, it's 20 years on at this
Yeah, but it
point.
doesn't go away.
Um, but
Yeah.
um, but it did, do something. So
What did it
it
do?
certainly made sense to me. I definitely felt so. I was thinking about my time in Afghanistan, like we
Mhm.
discussed, and I was looking at a photo of me and my husband, and we served in the army together.
Right.
And when I covered one side, um, you know, everything felt scary, and I started getting really anxious. And then the other side, and I felt very happy looking at the photo of
Isn't
us.
that
So
interesting?
it was
Yeah.
stark. It was
Yeah.
stark.
Okay, that's cool. Okay, so that's a good response. Okay, I will,
Yeah.
and so I always take a risk if I bring it up because as I
Yeah.
say, if someone doesn't respond, it sounds
It
like
could
it's
be.
a failure. But so
Right.
you had a good response, and you can use that. So as you said, if you want to pull up your mature side, you look out that side, and then if you want to talk to the traumatized side, you can look out the side that stimulates the negative hemisphere. And also, I want to say that we have a study that we published from McLean Hospital at Harvard showing that just looking at one lateral visual field or the other, we had people go into an fMRI scanner with
Mm-hmm.
goggles that had tape on it. And if you looked out one side, uh, it covered one eye and you only could see out half the other eye. And then, so if you look to the left, uh, you activated your right visual field and it lit up like a Christmas tree. And
Oh,
at the other
interesting.
side, it was dark. Now,
Mm.
it's not that only one side was working, but we were able to manipulate the data to exaggerate the difference between the sides.
Right.
And when we did that, which we were allowed to do because we had a hypothesis, um, it was really a fantastic result. And when the patient looked to the opposite side, the hemispheres switched, and the
Mm-hmm.
other side lit up, and the uh, same the same side. Um, I don't want to use like ipsilateral side,
Right.
was dark. They just flipped,
Mm-hmm.
so it's a real effect. Just doing this simple maneuver of just covering one eye and half the other eye, and if you look out the whole, cover one eye and look out one eye, it's not going to work because
Mm-hmm.
there you're stimulating both hemispheres,
Right.
and that's why you have to cover half of one eye and look out the lateral portion.
Mm-hmm.
And um, uh, and and if you're feeling distress, and it might even help with physical symptoms. A lot of times I'll give someone a light treatment, and they'll say my chest pain went away. I didn't even know they
Right.
were having chest pain. Uh, and,
Mm-hmm.
uh, and one time, and this never happened again, but it was a couple of years ago, I had three people in one day who said my hip pain went away. And I had
Mm-hmm.
them walk downstairs and walk up again. And they said, no, it feels good, And now it didn't last, and it wasn't a cure, but it
Right.
was interesting, So it can affect the body because the mind is connected to the body. Yeah.
Yeah, I think so many, especially my listeners, so many of us have chronic illness.
Hmm.
We've read all the Johnny Sarno books, Dr.
Yeah.
Johnny Sarno,
Right.
especially, and for good and bad reasons. We have many different, you know, feelings associated with this because sometimes you go to a doctor and they say, well, it's all in your head. And, no, it's
Mhm.
not, doc. I have something very real. I mean, it took me 4 years to get my diagnosis, and turns out it's not in my head at all. But that being said, many of us have been able to use therapy or other means to try to help along with our pain. And I've learned from my own experiences and reading about this and trying I've basically been at a point where I'll try anything if it might make me feel better. But the mind, as much as I want to say that I have this strong aversion to pain, I could get through anything, I'm chronically ill, I actually have a very weak tolerance because my mind associates anything with pain at this point. Everything that has happened to me over the last 5 years, I was starting to associate running with pain because every time I tried to run, my joints and muscles seized up and I couldn't move. So I've started to learn that sometimes, even though it may not, the source of my pain was not just in my head, but my head associates so many things. And I've been able to identify just an absurd list at this point of things that I've gone through that my mind now associates with pain. And I sort of recoil like, oh gosh, this is going to hurt. And I suddenly have a very low tolerance for pain as a
Right.
result. So, I think this crowd, my crowd, we really get it because, yes, on one hand, it can be frustrating if a doctor tries to dismiss you and say, "Oh, it's in your head. It's all something
Well,
up there." But there
one
is that
yeah, but
connection.
see the mind is connected to the immune system,
Right.
and if you're feeling anxious chronically or depressed, it has a negative impact on the immune system,
Mm-hmm.
and so you can get more colds, but you also can get these weird immune uh, responses, that can affect your joints, and so the pain is real,
Mm-hmm.
and there is a connection with the mind, uh, both with muscle tension can hurt a joint, but I think most of it is through the immune system, which is complicated, but responds
Mm,
to mental well-being or mental distress,
mm-hmm.
and uh, that there's a definite connection between how we feel, and how we perceive the world, and actually which side is dominating, and the immune
Mm-hmm.
system.
Right.
And did you notice any difference in your physical symptoms when you did that, or did you not do the visual thing for a long enough time?
I didn't do it for a long time. And right now, I'm in a period where, compared to, how I was feeling, I'm doing pretty good.
Hmm.
Although, I should definitely probably do that for a long period of time when my muscles are starting to feel really particularly tight, due to, the long list of diagnosis I have today. But yeah, I think, yeah, I should definitely give that one a try. Because I have tried out, I love to experiment. I'll give anything a shot. So I have, I do know that, my mind can associate certain things with pain, and it can, at times get worse just because my mind is bringing me there. Like, here we go again.
Well, pain is a trauma,
Hmm.
and um, and that's the thing about trauma, that it can begin with some childhood rejection, and then school failures, and then ridicule, and then drug abuse, and uh, each trauma adds
Hmm.
to the trauma, and then it can mount up, and then you can have people who really failed, and they're living on the street and
Hmm.
using fentanyl, and and uh,
Yes.
and that's who we're treating in our study,
Hmm.
that everybody in our study, with a few exceptions, has had 3 overdoses prior to coming in,
Wow. Yeah.
and um, uh, that uh, not in the study, but prior to the study. So we haven't had um, uh, any overdoses in the study. Uh, um, but um, uh, and I hope we get FDA approval from this study from the FDA, and then we can bring it to the public.
Absolutely. Well, I mean, the numbers you were giving me when we talked about it are phenomenal. No, half the you assume the half that is not getting the placebo,
Yeah,
their so their urge to have to take the drug is down 90%.
yeah. Well,
It's incredible.
yeah, that's it's the top 10%. Uh,
Yeah.
they're either 100% off, or down to 90%, and the bottom 10% have gotten worse by 15%.
Okay.
They've
Hmm.
increased their dose 15%, and they
Right.
usually drop out. And we can
Hmm.
tell. I wouldn't say we can tell, but we hypothesize. A given person, we they're not doing well, and we suspect they're getting sham, and somebody
Right.
else is doing real well, and we suspect that they're getting the active treatment. And it's hard for us to believe that so many people would do well with a sham treatment, a placebo treatment.
Right. No.
When you're
Yeah.
dealing with fentanyl.
Absolutely. And talk about this trauma that contributes to, in this case, fentanyl addiction,
Hmm.
and the pain that comes with all of that. We know, we're still learning a lot, but we know that many of the people who have these kinds of addictions came from trauma to get there. These are people who
Yeah, they all have
come from traumatic
hundred
backgrounds. They'll
percent.
often come, yeah. So it makes sense. And we don't really talk about the trauma that leads
No,
to
no,
the
you lock
addiction.
them up, it's
Yeah, yeah,
yeah,
exactly. Lock them up.
yeah,
Lock them up
yeah, or
instead of,
just
hey,
say
what?
no,
Yeah, yeah, I'll
uh,
just say no. Yeah.
like Mrs. Reagan used to say.
Yes, yes. Well, I think now this is starting to get, I mean, it's been what, 40? Uh, I
Mhm.
guess it's been a while, but yes, we used to get those commercials all the time. I remember the egg cracking. But it is trauma. This isn't happening to groups of people who are walking into this without trauma. And the fentanyl and
Yeah, and
opioid
every
epidemic
person
really hit
we
places like West Virginia hard because
yeah.
these people are living in trauma.
Right, right, exactly, and we evaluate them. We have trauma scales and so forth, and they all have extensive trauma history. So we're not giving them therapy, psychotherapy, because it's too hard to study it. It confounds,
Hmm. Right,
because different therapists have different abilities,
right.
and but the light is easy to, if it works, it's a known quantity, and it's a different. Comparing it to a sham is a fair comparison. So
Hmm.
these people are getting better without psychotherapy. If you use it in my practice with psychotherapy, it's much more
It's far more
powerful.
efficient,
Yeah.
effective.
And,
Yeah.
but we
I
know from our scales, when they come in, they're given some trauma scales, and they've all had severe trauma, which I would expect. And then the
Yes.
fentanyl is a huge trauma, and they feel like
Hmm.
failure, and they can't get off this, and
Just
so
compounds.
each trauma kind of adds to the old trauma, and people
Hmm.
forget about the old trauma. They'll say, "Well, I'm a drug addict," and then feel really
Yes.
bad about themselves.
Right.
And I like to say I don't have any addicts in my practice. I have trauma victims who
Hmm.
have abused drugs, or use them destructively, and
Hmm.
we want to attend to the trauma and the use. And interestingly, I can give either the glasses, or the light treatment in my practice, and someone can have drug cravings on one side, and not have them on the other side,
Hmm.
just flipping the glasses, and
Yeah.
and uh, and if I give somebody a light treatment, they can come in with like a 8 out of 10 craving for opioids, and after their treatment, it's either way down. Usually, it's off,
Hmm.
and that's true with alcohol too, and gambling.
Right. Yes. Both. Yeah. And
And
it's,
and
it's
and, and
interesting.
again,
Those also things associated with trauma.
yeah, and to plug my book again, I have,
Mm.
it's all about this, and how
Right.
there are narrative fiction descriptions of therapy sessions, and talks about the research, and how to help yourself with it.
Yeah. And I think it's phenomenal. And I encourage everybody. It is, you can get it tomorrow through Amazon.com. Yeah, the long title being Goodbye Anxiety, Depression, Addiction, and PTSD. I thought the top was cute. It's just all crossed out. So my brain immediately said dual brain psychology. Because that's that came
Mhm.
across so positive, and cross out all that crap I keep trying to get rid of, which is difficult. And I just think it's very, whether you're dealing with a fentanyl addiction, a family member dealing with it, or something else, everybody who is dealing with chronic illness, we have a certain level of trauma. And starting this podcast, going through everything I did, it's given me a very different perspective and a set of empathy, this empathy that I might not have had before, because I know people get to various places because they got there through trauma.
Right.
And you go through so much and you start to lose trust in medical professionals because you're still sick.
And also, if you
You're starting
can,
to feel like you can't live without certain things. So you go to the next doctor, like, oh, what's the next med I need? I think I feel something else again. It's all coming back. And
right.
next thing you know, you've got 14 prescriptions, and you just feel like you can't live your life without this. And I see over and over and over again in the chronic illness community where we have our own types of addictions, but we just don't put that down on paper. You're an addict. We say you're chronically ill and you have your bag o drugs. There's even cute little funny bags out there you can order that, your bag o drugs. But you have to really ask yourself, what am I doing here? Am I not dealing with trauma in a positive way?
Yeah. And I prescribe very few drugs because
Yes.
I feel that most of them don't work.
Right.
Um, and I have to say that this work is very effective. That people get
Mm-hmm.
better, and uh, and I think just even using it with when from the book or blocking your eyes, that if you can get the concept that there's a person inside who's hurting,
Mm-hmm.
and it's sort of like the inner child, but I don't like the term inner child because it's been, bannered around and trivialized. But there
Right.
actually is an inner child in there who knows that the trauma is going to recur,
Mm-hmm.
and often repeats the trauma to to have a sense of control,
Yes.
and um, and but I think it's really helpful to have this concept of two minds, and
Mm-hmm.
and rather than I'm suffering from trauma, there's a part of me that's suffering from trauma, and there's a part of me that's healthy,
Mm-hmm.
and I think it's a better perspective and a more
That is a great
realistic
perspective.
perspective.
Yes, because it's so easy to just see the trauma in ourselves, to see the hurt, to see the brokenness. I am a
Hmm.
broken. I've said that a million times. I feel like over the last 5 years, I'm a broken person. But there is a healthy side to me.
Yeah,
You just have to
absolutely. I'm talking
work
to it.
towards that healthy
Hmm.
side and understand that the broken side is there. And I get
Hmm.
better each and every day. So thinking of it that way, I think, is so important. I still remember right after they finally diagnosed me with drug-induced lupus, every new drug they put me on, if I go out for a run or try to do something and everything started hurting, I'd call my doctor. It's happening again. It's a drug-induced lupus. And if you Google drug-induced lupus and your drug, now everybody's afraid to take medication. There's a decent chance that your medication is associated with it. But I thought every single med I took, I was like, oh, here it is. It's happening. I know it is. I know it
Right.
is. But I just could not get through the trauma of it. But obviously, there was a side of me that was doing better because I was still living life. I was still picking myself up and going outside. So I like that perspective. And I'm really excited to hear about the infrared study when it's completed and the FDA approval.
Now we have a completed study that's published where we treated
Okay, so that one's already, the fentanyl study's already completed?
no the fentanyl study. We're at my site. We have two sites
Okay.
where we're doing it, and at the end of this month, my site will be completed, and McLean Hospital is doing another
Hmm.
site, and they'll finish probably in October,
Okay.
and um, but we have a phase one study where we treated 40 subjects, half of whom got sham and half active. And there was we measured, it was focused on cravings, and it was heroin, not fentanyl. It was before fentanyl.
Okay.
It was in, I think we finished it in 2021. And,
Hmm.
and, um, and there was a huge difference between the active treatment and the sham treatment for craving. And also for those who were using, there was a gigantic difference that they were um, uh, either, most had come off of the heroin who
Hmm.
got the active treatment. And the sham treatment didn't.
It's
So,
interesting.
and that study is published. Um,
In 2021.
And I
I'll
have
take a look
a
for that.
website. It's called dualbrainpsychology.com,
Mm-hmm.
and there are papers that have links to them. So this is a study that we published in it was either 2021 or 2022.
And I'll have your website in the show notes as well, so everybody can go there because it's fascinating work. And there's just so much more we have to learn about the brain and how it affects
Mhm.
us, and how it
And very few
relates to your
people think
body.
about the hemispheres. In other words,
Mm-hmm.
I think I'm the only researcher who actively, considers that the hemisphere is the most important brain area. Everybody's
Mm-hmm.
looking at the amygdala and the hippocampus, and there are
Right.
actually two amygdalae. There's one in the left brain and one in the right brain, and that's
Mm-hmm.
true for all of these uh, parts of the brain. But I think when you put them all together in a hemisphere, you can actually, sorry about this, uh, you can actually put half the brain to sleep. And neurosurgeons do that as before surgery as a test.
Right.
And, and the person can communicate when half the brain is asleep.
Interesting.
Yeah.
Huh. That says something. Well, I love the studies. I'll look. I'm looking forward to your next book to tell me more about that because now I want to know about that. Um, it's just so fascinating, and I think that
It's in the book.
for many of us, um, you know, we'll keep learning more about why we experience pain and trauma the way we do. The more that we understand our minds and how to treat it, so um, that's really fascinating to learn about. So uh, I'm excited. I'll be keeping a lookout for the infrared at the FDA. Hopefully, it's not caught in some foregone
Yeah, we don't know
department.
where the government has gone.
Just
Yeah.
it's off
Well, we know
somewhere
where
in
it's
a
gone, but
portal.
we don't know what's left. Yeah.
Yeah, we have no idea, but I'll keep looking for it. And if they got rid of the department, maybe we can put together a proposal to see if we can't come in and take over and finish that stuff up or something. They gotta finish that. Somebody has to do this work. We need help.
We're going to finish the study, and even if we stopped at this point, we'd have enough data. But but we have to get FDA approval to bring it to
Mm-hmm.
market
Yep.
because it's a medical device.
Yeah. Absolutely. Well, thank you so much for coming on. This has been a great conversation. And everybody, don't forget to order your new book, Goodbye Anxiety, Depression, Addiction, and PTSD Dual Brain Psychology, available on Amazon.com. So thank you for being here, Dr. Frederick Schiffer. This was a great
Thank you.
conversation.
Thanks so much. Thanks. Good.
That's a wrap for this episode of Living Chronic. I hope today's conversation gave you insight, inspiration, or at least a little reassurance that you're not alone on this journey. Living with a chronic illness or disability comes with its challenges, but it also comes with strength, resilience, and a community that understands. If you enjoyed today's episode, be sure to subscribe, leave a review, and share it with someone who might need to hear it. You could follow me on Instagram at Chronically Brandy Schantz, other socials at Brandy Schantz, or my website at brandyschantz.com for more discussions, advocacy updates, and everyday strategies for thriving with a chronic illness. And if you have a topic you'd like to hear about, send me a message. I'd love to hear from you. Until next time, keep pushing forward, keep advocating for yourself, and remember, you are more than your diagnosis. You are powerful, you are unstoppable. Thanks for listening to Living Chronic. See you next time.